components of communication partner training programs in stroke, TBI and dementia. Thank you.
Good afternoon. I'm pleased to be here today to present this research undertaken by myself, Dr. Emma Power, Dr. Robin O'Halloran and Rachel Reading. Our study attempted to determine whether multiple CPT programs for stroke, TBI and dementia could be consolidated into one efficient training program for use with care staff to increase efficiency in this area. As numerous systematic reviews indicate, CPT is effective in addressing the negative impact that untrained carers can have when conversing with a person with a neurogenic language disorder. And it's especially vital for unfamiliar communication partners such as care staff due to the increased risk of adverse events in the hospital setting for patients with a communication impairment. However, the CPT programs that have been developed to date are disorder specific, which does not reflect everyday practice, where care staff are expected to communicate with people with various communication disorders. Ideally, one CPT program would train staff to communicate with people with various disorders, and theories such as the communication accommodation theory suggest that this may be feasible. So our objective was to determine whether, to determine the common and distinct components of evidence-based CPT programs for unfamiliar communication partners of people with stroke, TBI and dementia. And this is the first step in determining whether a consolidated CPT program for various communication disorders is feasible. The first phase of our qualitative method involves selecting programs to include in the study from systematic reviews of CPT programs and from literature searches using specific selection criteria, and 4 CPT programs met our criteria. The second phase of our method was finding a comprehensive system for recording data and forming a data sheet. We used the intervention taxonomy and the TIDIA checklist to do this. The third phase of our method was the data extraction using program manuals, study articles, and any supplementary materials like videos. We recorded delivery information such as location and dose, as well as program content such as educational information and strategies. And the final phase of our method was the analysis. So with information categorized, we used open coding to compare data across the programs. So our findings. So this table represents the main features of delivery of CPT programs for care staff. All programs were delivered face-to-face in groups using either information sheets or manuals by a speech pathologist. However, all other features of delivery differed, including the level of recommended adaptability, measures of intervention fidelity, and especially the duration of the programs, which range from 1 to 35 hours. The next level of our results was related to program content. This table depicts the broad content codes derived from the data that were common to all 4 programs, and there were 6 other codes that were common to 3 or less programs. Despite the similar broad codes, the proportion of the programs dedicated to these codes differed largely. The third level of our results is the methods of learning that were used in the programs. 2 of the programs used mostly active methods, such as practice conversations, and the other 2 used mostly passive methods of learning, such as watching videos and trainer demonstrations. Our final level of results was the specific strategies that were taught, as well as the negative communication behaviours to avoid, which is effectively the opposite of a strategy. The 96 individual strategies in the programs and 26 negative behaviours were categorised into 12 groups according to the domain of communication that they target. 6 groups of strategies and 2 groups of negative behaviours were common to all 4 programs. However, when we looked at the individual strategies, we found that only 3 of the 96 strategies were common to all 4 programs, and no negative communication behaviours were common to all 4 programs. In fact, 70% of the communication strategies were only found in 1 program out of 4. So our research found that while there are similar categories of content and features of delivery for CPT programs across disorders, there are marked differences in the methods of learning used, the individual strategies taught, and the lengths of the programs. While these differences don't necessarily indicate that consolidation of CPT programs is not feasible, further research is needed. The difference in learning methods points to a need to determine whether passive learning methods such as viewing videos are adequate to change communication partner skill, or whether active methods are required. A further aspect to consider is the dose or duration of required training to change communication partner skill. It's also unclear whether the 70% of strategies that were unique to individual programs could be relevant to other disorders. And this could be evaluated through clinician consensus or by referring to the efficacy of individual strategies in the literature. In terms of implications, we hope that clinicians can use the identified core components of CPT in practice by evaluating the quality of the CPT that they implement. However, more pressingly, we hope that the presence of the overlap of content and delivery methods in CPT programs indicates the possibility of further research and refinement of formal CPT training. I'd like to acknowledge my co-authors of the paper and the people that have helped with this presentation, and please refer to our published paper for more information. Thank you.
We have, I think, just under half an hour for afternoon tea. We've got some more posters, so please take some time to have a look and speak to the poster presenters. Also, Linda has asked me to just check with you if you've got time to go to the AAA table and talk to the clinicians there and have a look at what items they have. I think there's lots of resources you've got there, Linda, is that right? Yeah, so please go and talk to them and have a visit.